The Birth Circle podcast features experts in all the nuanced areas of pregnancy, birth, and postpartum with the aim of helping women make the choices that will keep them safe, healthy, and empowered. We respect all birth choices and believe in supporting informed consent and evidence-based practices. Nothing said on this podcast should be taken as medical advice. You should always seek the advice of a competent professional for your care. Welcome to the Birth Circle podcast.
This is Sarah with Birth Circle, and today I'm so excited to have Elizabeth Davis with me. And Elizabeth is the author of Heart and Hands, A Midwife's Guide to Pregnancy and Birth, and she's spoken all over the world. She is involved with the National Midwifery Institute, has a ton of experience as a midwife, and we are going to be talking about what the current world looks like in midwifery and orgasmic birth. So I'm really excited to ask you lots of questions.
All right. Can't wait.
So first of all, how did you get into this? Because, how did you fall into the birth world?
Well, I'm a child of the 60s. So, or rather,
Say no more. Is that what you're saying?
Yeah, pretty much. We were the back to the landers, like looking at sustainability before that was a term that everybody knew. And hospital birth at the time was so far from humane that it's shocking. I mean, for me, of course, I wanted a home birth, but I couldn't find a midwife. They were hard to come by.
How many people even considered home birth, or was that what only?
Well, there were the fringe of us that did. I was living in rural Oregon at the time, and I just happened to fall upon a couple of books. The only one that really talked about home birth was called Common Sense Childbirth, and it's a classic. And it convinced me that I could do it. Sheila Kitzinger also, The Experience of Childbirth, so powerful to see those pictures of her birthing her twins at home. And I just thought I can do this. So I looked and looked and finally ran into a pregnant woman in town, and I went up to her and said, what do you know? Do you know anything? She said, well, this is my third baby, and I'm happy to invite you to my birth.
Just a random stranger.
Yeah.
Oh, yeah, I love this.
She was a sweet woman, and I said, okay. I was 21, I'm ready to go. And so she gave birth in a milk shed with no assistance, but actually the people that were there were the adoptive couple.
Oh, my goodness.
It was her third baby. She didn't feel that she had the resources to have a third. And these friends of hers had tried forever to have a baby. And she decided that she would give them this baby.
Wow.
So not only did I see birth in the flesh, the real power of it, but I saw her hand her newborn to the adoptive mother who put it to her breast. Even now.
I know.
Now. And I remember what I was wearing that day. I remember my body that day. It just birth has that power to impact us and imprint us.
I was going to say, it sounded like you imprinted on the most powerful human experience.
Yeah. So that was my initiation. However, well, of course, what happened after was I went to her and I said, will you be my midwife? And she said, well, I'm not a midwife, but I will be at your birth.
Oh.
So the tough part came when I went into labor a month early, and she was not in town. And I had to face I did not have any information. All I had were some basic supplies. I had really no support. We lived an hour and a half away in a rural area, hour and a half away from a hospital, and old pickup trucks, snowing outside.
Wow.
Nobody should have to make that kind of choice.
Yeah.
And I did go to the hospital because I didn't know what else to do. I was worried about premature, and all of that was on my mind. So I did have quite a brutal experience with that birth. And they really, I call it the dark ages of childbirth, where they used to tie women down, and they tied me down. They didn't give me any drugs. I wouldn't let them give me any pain medication. But what they did give me was Pitocin, and they gave it to me orally, and it triggered this unbelievably painful fast. I mean, I had 10 seconds between contractions, so there was a lot of screaming going on.
No time to catch your breath, no time to ground.
No, it was beyond that. It was so painful because there was no accommodation. You know, you just shoot to the top. There's nothing gradual about
Yeah, there's no build. Yeah.
It's like slam. It really was very violent experience. Yeah. And the hardest, maybe the worst part of all was they cut a lateral episiotomy.
I'm doing the math on that one.
Yeah, well, you know, that's contraindicated in every textbook you ever read. And who cuts the vagina sideways and expects it to reapproximate and heal? You know?
My gosh.
So I was in so much pain almost immediately from that. And they said, would you like something for the pain? Now, mind you, I wanted my son right away. And they said, well, he's cold, he's not breathing properly, he needs to go to the nursery. And you know, that's that moment of really becoming a mother. I said, just do whatever is best for him.
Yeah. What are you supposed to do at that point?
What you do? So the pain, would you like something? Yes. I wake up 7 hours later, not having seen or held my son. And I knew about bonding. I knew what happens with mammals when their bonding is interrupted. I know what that instinctive rejection response is like. When they finally brought him to me, they had pomaded his hair. They'd styled his just. So, you know, I figured it out. We're getting out of here. You know, they're not going to let us out. We're going into the nursery. We're picking him up. We're walking out the door. I'm going home. And I'm going to breastfeed this baby, and it's going to be okay. Well, he's, 46 right now?
Yeah.
So it all worked out. It all worked out.
Wow. And they let you walk out of the hospital? No big deal.
Well, not, you know, they were threatening, but what could they really do? You know, they couldn't. In those days, there wasn't like child protective services. We didn't have to worry about that aspect of the way that hospitals protect themselves, quote unquote. With threats like that. So 2 years later, I'm pregnant again, and now I'm in California, and now I found a midwife, and now I'm going to have a home birth. So it was just glorious. I mean, it was unforgettably wonderful and beautiful and magnificent, and you know, I remember the day. It was a sunny January day, and the lobelia was blooming in my flowered, you know, pot right outside my bedroom window. And it was a posterior labor. I mean, it was no piece of cake as far as that goes. But I got to that place where I really felt the ecstasy of birth, and I also experienced the transformation of my previous experience. I know I was re-imprinting myself as a birthing person.
Yeah.
In those hours of being like somewhere around 8 centimeters, you know, and just doing that deep, deep work.
Deep, deep work.
And the orgasmic part, that was not in my vocabulary with birth. You didn't put those two words together. And yet, because I was so worried about tearing over that episiotomy scar, I just totally I became my vagina, let's put it like that. I was
very cool.
So inside and really, really trying to feel everything so that I wouldn't blow it and push it too hard, or, you know, I couldn't go through that endless pain without it lasted forever. And in that process of being my vagina, so to speak, and really feeling my daughter's head and letting all that pressure happen, my breathing changed. You know, it became, when they say breathe your baby out, I hadn't heard that phrase either, but it was all, you know, I was so into it. And when she was born, I remember the feeling of her body coming through me and the just crescendo of sensation and emotion. There you have
even 44 years later, you still can feel that in your body. Like your body remembers this.
Oh, yeah. Yeah. So orgasmic birth was just, again, we didn't have that language, but meeting Debra Pascali-Bonaro, I don't remember how long ago, it must have been about 14 years ago, something like that, at a conference. And she was working up this project on orgasmic birth. And I went up to her and we, became fast friends. And she said, I've got these film clips and I'm showing them around the world. And every time I do, women come up afterwards and they say, I never told anybody. Just like this taboo.
The first time I saw the clips, I'm sure we're talking about the same ones.
Yeah.
First time I saw the clips, I was like, are we allowed to watch? Like, is somebody checking my adult card? Like, am I old enough to watch these?
Good. That's great that you watched them when you were however old you were. But and so the book came around because I suggested it. I said, I'm sure people are asking you, is there a book and how do we do this? And I was primed to write that. I really wanted to write a book that started with the physiology of birth, which is the first chapter. What is birth? Looking at the physiology, the hormones, the change in brainwave frequency, how we go into an altered state physiologically. And then once all of that's laid out, then let's talk about options of where you give birth. And let's talk about how birth in the hospital typically derails not just the physiology, but the transcendence that's inherent in the birth experience, So I hope you'll all check that book out.
Yeah.
I'm pretty proud of that one.
I want to ask too what you mean by orgasmic. Like, are you literally meaning orgasm? So, talk us through what an orgasmic birth is and isn't.
We very broadly interpret that phrase. So there's an orgasm and then there's orgasmic. So what is orgasmic? It's ecstatic, it's juicy, it's transcendent, it's sensual, it's powerful, it's
so like my favorite ice cream.
Well,
like eating my favorite ice cream could be described as orgasmic a little bit, right?
I mean,
okay.
I've even done research on it took me forever to find an image of female orgasm. And I realized that most of the images that we've all probably seen illustrate the male orgasm. This is so true in medical texts. And but I looked and I went back to Masters and Johnson and I actually discovered an image for female orgasm, which instead of just one version had three. And interesting, and the classic, the arousal and then the peak and then the resolution. But another image given for the woman besides that was one where she kind of goes up to the top and bounces along, you don't really. Women always do this. They shake their head when I share this information. And then the other that was so interesting, the one that had the highest peak, on the way up, there were these little pauses. And I went, those are the plateaus that we have in normal labor. This, and I asked groups of women, what you do relate to this? Those little, and they go, yeah. So what are you doing in those pauses? And they'll say, oh, I'm just trying to open up to hold more sensation, or oh, I'm just trying to change my breathing, or maybe just shifting my position a little. But the magic word for me, the one I always wait to hear, is I'm integrating. And then I can say, so this is our sexual nature, and it extrapolates beautifully to birth. Progress in labor is not a straight line, neither is our orgasmic process. So now we just have to change the language and the expectations in the medical world to reflect the truth about who we are and what we are. And there are new studies, like the latest study that I've seen, an excellent study, beautifully controlled, showed that out of I think it was 5,000 births, really well controlled, term, head down, singleton, right across the line. And the average time from 4 to 5 centimeters was 7 hours. And another plateau shown at 8 centimeters. And I thought,
I can
now
see
we have
that.
the evidence to support what midwives have known and women have experienced all along.
So you're describing the entire process as orgasmic, building to that peak, and not just the fact that, because I've heard people say, "Oh, orgasmic birth, that's a joke. That didn't feel good."
Sure.
And
Well,
they think that you're talking about having an orgasm at the actual moment of birth.
I'm talking about, depends on how you want to look at it. You can look
Well, yeah,
at
now
the
I'm
whole thing,
saying,
but
yeah.
what I do take care to say is you can have a lot of pain in labor and still have an orgasmic birth. I mean, you can have a back labor that's kind of really takes everything you've got and still reach that point of pushing your baby out with an orgasmic dimension. And the other thing, as soon as the book came out, on some chat room, I saw somebody complain and said, so not only do we have to have a natural birth, now we have to have an orgasm.
I've heard that too. Yeah, actually.
And I responded and said, orgasmic birth is not a performance standard, but it is every woman's birthright.
Mm-hmm. So what are some of the external things that can influence, can encourage an orgasmic experience?
Oh, well, there's so many things that, I could follow you through that a little bit, just through some of the chapters. I mean, being healthy really matters. It's not, and that's because you have more choices about where you give birth. The healthier you are, the less likelihood you've got for complications to arise in pregnancy, and the more likely you are to have control over your process, or at least control over where it takes place. And your sexuality, unraveling. And so many of us have all types of abuse in our history. We have maybe physical, maybe sexual, certainly emotional, gynecological, obstetrical abuse. And all of these things deserve respect and opportunity to go deep and work through.
Yeah.
And I think that's significant too in how we prepare, and but just reclaiming your sexuality and reclaiming it, enjoying it through pregnancy. One of the final entries that went into the book, it was a story that one client told, was using the vibrator while she was in labor, and how much it helped. Like, she stopped using it when she started pushing, but while she was dilating, she definitely found the vibrator to be tremendous in terms of pain relief. And we thought about how that might extrapolate to hospital birth, where a woman comes in and kind of sets her stuff up on the table.
And the nurses come in and go, okay, what kind of
vibrator
party we having here?
Yeah, right. And maybe stay back a little.
Yeah, exactly. Don't cross that line.
No.
So do you think that this type of experience can help heal sexual trauma, all the types of traumas you talked about just a minute ago?
Yeah, well, what I've long been interested in intuition, long been interested. I mean, since I was a child, I've had this capacity, and I used to get in trouble for it, not really understanding the parameters of what I was supposed to see and not see, or supposed to say and not say. And
that line's a little fuzzy sometimes.
Yeah. So as I explored it more, I realized that oxytocin is a powerful agent in our intuition. And you can link that to the cycle, to times in the cycle where levels are really high, like with ovulation, if you're not on hormonal birth control. We have a natural peak at that point, and premenstrually, or at the initiation of menstruation. And then I studied women's dreams at this time, and their performance academically, physically, and I saw this is something that we need to pay more attention to. And then, now I know the correlations to birth as well. So, yeah, like what oxytocin seems to do at really high levels is have the power to change brainwave frequencies to a much slower and much more deeply intuitive level. We have 3 primary waves. We've got our beta frequency, which is our coffee drinking, individual, fast thinking frequency that, we're in a lot of the time. And then we know the alpha, where we slow down, maybe with listening to music or working in the garden or doing the dishes, maybe, or folding laundry. That's any kind of rhythmic activity takes us into that alpha. And even when you look at the waves, they become a lot more fluid and a lot more, the amplitude, a lot more possible, that they synchronize with the waves of those around us, which is one of the ways that we can see intuition. That
And that's,
we're literally
connecting with others. That's part of intuition.
Theta is the deep one. That's the as deepest you can go in a waking state. And there you're having these long, deep waves. And the qualities of theta that people comment on is that in theta, time really stops. And I think about all the times at births and how, hours seem like minutes and minutes seem like hours, and time just becomes very elastic.
Yeah. And I noticed as a birth worker, I'm not even the one in that, but syncing up with a pregnant woman, 4 hours of labor will feel like 15 minutes, and we're all just right there with her.
And that's the beauty of it. And that's something else I love to say is, when you're at a birth, you really have only 2 choices. And the first is to run the energy of fear.
Yeah.
And the second is to run the energy of love.
Mm-hmm.
And the older I get, the more I think those are the only 2 choices you have in life anyway.
So it's a good point, huh? Yeah.
So if you decide to
everybody in your room, everybody in your birth team is running on waves of love,
then you're going to go on the journey with her. And you're going to change your brainwave frequencies too.
So it's almost that the birth team also experiences the orgasmic part of the birth as well, because if it's a syncing up of synchronicity of brainwaves, then we're right there with her.
Yeah, right, exactly.
Not experiencing it in her body, obviously, but does that amplify then if you connect with others? If that intuition, does that amplify your own then?
Yes, there's no better school of intuition than birth work.
You're like blowing my mind, Elizabeth.
Well, there's more. There's one more thing I've got to tell you about those theta waves is, and this is a hard example, but there was a study done in the UK showing that women who had been raped had flashbacks of their experience during their labors. And I've not been raped, but I'm sure all women imagine, and I've had trauma in my life, so when I imagine how that would be, I would fight.
That's what I see.
I would fight.
They fight.
Adrenaline like mad, but I think that then there may be a point sometimes where you go, you're not going to win. And you really just have to let go, and you drop down to the deepest level you can to survive. And that's why trauma memories are embedded in theta, and there they are, previous birth or trauma before, and labor gives you an opportunity to change, re-imprint those negatives to positives.
If you store your trauma in theta, but then you go into theta in safety at a birth, you're very, very careful with your birth team and you've prepared.
Yeah.
Then you're going to that place. It's almost like wiping the hard drive, right? Not completely forgetting, but you're rewiring, reset.
Yeah.
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 That's why, because I know that I've seen, and I've had people tell me all the time that they accomplished more in therapy at their birth than they did for years in talk therapy because of the state of their body, and that talk therapists, that talk therapy doesn't even get to the crux
No,
of
it
the
doesn't.
pain of sexual abuse.
No, you
But-
gotta do EMDR or
Yeah.
deep hypnotherapy, and so those I really encourage those in all of my work.
But
because
birth does it naturally.
birth does do it naturally.
Wow.
Yeah.
And that's the science behind it. Because I love to see like, hey, that does this, but then this learning the science behind why it does this. That's so yummy.
Wonderful, huh?
Yeah.
Yeah.
Wow. So what do you feel how do you feel about unassisted birth? Because I know a lot of people I don't think
Well,
orgasmic birth, first of all, is a fringe movement. After you've described it, it sounds like you could have it pretty much anywhere if you have your space and your mindset
Yeah.
set up, right?
Yeah.
But it just seems like orgasmic and unassisted birth kind of in most people's minds are there. Because I guess the video I saw was a lady in a hot tub looking like she was in the throes of,
Yeah.
right? And so we all look at that and we go, whoa, that's super, super fringy for us. So how do you feel about unassisted birth and how does it relate to orgasmic birth?
There are so many stories in the book. You know, the second part of the book is stories, and they are as varied as we are. You know, like so. I think it's good to step out of that. I mean, I know the video is very exciting, but it doesn't always look like that. Unassisted birth is, I think it's wonderful, and I think that women choose it for a variety of reasons, maybe financial, to just have more control over the experience, the quality of the experience, the intimacy of the experience.
Can you consider a birth unassisted if the midwife's there but completely hands off? Could you?
You know, I did I did this practice once. I was teaching in Australia, yes, and I was I given the keynote. And I was coming up on a workshop, and I very often save my planning on a workshop to the last minute, and then it kind of gels, and I know what I'm going to do. But in this case, I could not get a handle on what I was to present, and there were some awkward moments at the beginning of my talk. I shared information that I thought was revolutionary, and it was not well met. I think because these were mostly hospital-based midwives, and they weren't understanding really what I was suggesting. So not knowing where to go next, standing there blankly in front of 150 people, I said, let's all just close our eyes. I mean, I had no idea what I was saying. It just
just go with it, right?
Yeah, let's all just close our eyes. And I led them through a guided visualization of birth without giving any details. But imagine that you're having a baby. It's not the birth you've had before. Maybe it's been 40 years since you birthed, but see yourself looking down and seeing your big belly, and now labor is beginning. So I took them through the whole thing, still not really knowing where I was going with it. But the questions came, and the first was, okay, how many of you were in the hospital? Like maybe 10 hands went up. How many of you were in a birth center? A few more. And then how many of you were at home? Yes. And it all,
wow.
Please look around.
There is some serious intuition, some inspiration on that. Yeah, that's true.
But then the next questions were, how many of you had your midwife really close in and working with you?
No,
a few. How about how many of you had a partner or a close
I was going to say,
friend?
my partner's right in my face. In my mind, I kind of went through that exercise quickly as you're saying it. Totally, the partner's right there.
But a good number of people did. But then, how many of you were alone? And that was the vast majority.
Wow.
So I said, so this is the truth of what birth is, and now all we have to do is figure out how to teach to it. And I was launched. That was the workshop.
Wow.
So that's. I think that, I mean, you study mammalian birth. Mammals don't call the whole tribe in to give birth.
Well, we know you don't mess with a mother cat when she's giving birth. We know that. So why would we mess with a mother human? It just doesn't make sense.
Right. So that's the edge between between midwifery and unassisted. And the more midwifery is mainstreamed, and I'm certainly part of that because I have a MEC accredited school, but the more we mainstream and the more this becomes a, quote, career and not so much a calling, the more likely it is, no matter how we strive to teach non-interference, it takes a lot of maturity to really understand what that means. You know, like the way that I try to describe it to my students, I say, you know, when you go to a birth, you've got your bag of your solid bag or bags of stuff. You've got your tools, you've got your herbs, you've got your homeopathics, you've got oxygen. And then over here, on the other hand, you have this invisible bag. And in this invisible bag, maybe was a hard outcome on the last birth, or a fight you had with your partner in the morning, or worry about one of your children, or a bias. We've got biases, we all do. He said, and you know, we'll always have that invisible bag, but before you cross the threshold into her birth space, you need to open it up and know what's in it.
Or leave it at the door.
Or leave it at the door. Okay?
I actually tell my clients, because I'm not the midwife or the doula or anything, but I do tell my clients I have a very busy life. I'm very, very active. But when I come to your birth, just know that no matter how crazy it is to try and contact me before or how absent-minded I seem, when I come to your birth space, everything stops at the threshold. I leave everything and I come into your birth. And it doesn't matter how long I'm there, I am 100% with you.
You're totally right. And a lot of midwives don't do that.
Well, it was a journey for me to learn that. But I've never had the pressure of being the midwife, too, because I've also, again, since I get to sit back and watch, as the filmmaker, I see midwives bring in stuff and they'll be all angsty. And then, you know, in the kitchen, they'll say to me, yeah, my client yesterday was in labor for 3 days and in a C-section, baby's in NICU. I'm really worried. And I'm like, why the heck are you bringing it into this birth?
Yeah, exactly.
Why are you here? Why is your backup not here? You need sleep. But it's really hard. You know, as the midwife, you've just got to keep going.
Also, like I think it is really important for all of us to pay attention to science and know what a good study looks like and be skeptical of research. Who funded it? What were they hoping to prove? All of this matters, you know. But probably matters much more that we have a clear repertoire of core responses to complications, that we really understand the physiology of complications in labor, and we know the most effective ways to respond, like shoulder dystocia. You've got to know your stuff. And if we have that clarity, then that can give us a level of confidence where we're not scattered and bringing in all this stuff. That anxiety is never a good thing at a birth. And I think that too many women have been disappointed by their birth attendants bringing that kind of energy in. And that's one big reason for unassisted birth. But I have another story. Do you have a moment for this one?
Oh, definitely.
Okay. So this mama is part of a group of people that I know in this area, people that I listen to music with and dance with, you know, just a fun group of people, all ages. And she and her young man did not want a midwife. They just flat out said no. And all the women my age in the community called me up and said, "You've got to do something." I said, "No, I don't. This is not my birth. I'm not doing anything. She can contact me if she wants to." And she did. She contacted me and said, "You know, I'm hoping maybe you can see me and help me know if my dates are right." I said, "Sure, let's try to see you at what you think might be 20 weeks. Because I know that uterine size at that time is predictable, no matter how large the fetus or fetuses are. You can really count on a certain size and shape. And the increments of difference per 16 weeks or 24 weeks are really dramatic. So you can really date a pregnancy well that way." So I checked her out and she was spot on. She was so happy because the sex was incredible and she was wanting it to be that time. So she then at the end of pregnancy, she called me maybe around 30 weeks and said, "I'm kind of wondering if my baby's head is down." So I said, sure, I'll meet with you and we'll check. So I found the head was down and I showed her how to feel the head down so she could reassure herself. And then I also taught her how to move her belly, move her baby within her uterus to feel the fluid, because maintaining a normal but high level of amniotic fluid is the key to continuing healthy pregnancy, even if you go over your dates. So she got that down. And then I didn't hear from her. I didn't hear from her until she was almost 42 weeks.
Wow.
And then she called me up and said, what should I do? I said, well, I'm not your midwife. What do you think you should do? She said, well, I've read some stuff and I know I could induce labor, but I don't really want to do that. It just doesn't feel right to me. And I just want to trust my body and keep going. So I said, okay. So she went to 43 and 5 days. And at 44 and 5 days, she gave birth. And I know what a dysmature baby looks like. You know, with dysmaturity, the actual syndrome that we worry about, the baby's all shriveled, it's lost its body fat, it looks like a wizened little old person. So I couldn't wait to see a picture of the baby, and the baby was pink, plump, and term.
Her dates were wrong.
No, they weren't.
No?
No, they weren't.
She just cooked them slower?
She said, well, you know, my mama went to 43. And my auntie went to 42 and a half. And I just figured this was normal for me. Now, in California, you have to turn women over at 42 weeks, regardless of your skill set, regardless of your ability to continue to assess for fetal well-being. And that's just the tip of the iceberg on the challenges facing midwives right now, which is we lack autonomy. Our protocols are dictated by obstetrics.
Yeah.
We really have not gotten out there and said, here's how we assess dates. Here's how we continue to assess well-being. We can estimate amniotic fluid volume by palpation. We can make note of fetal well-being by not only by mom doing kick counts, but listening with a fetoscope for an extended period of time and noting good variability and reactivity. We've got the skills. But whenever a midwife gets in trouble or somebody gets a hold of a proposed piece of legislation, they call the doctors in and they impose their standard of care.
Yeah.
And this is an international.
And it seems like a cyclical problem because they do these standards of care because the mom's not informed and not connected with her body. And so because she's not allowed to be connected with her body and informed, then she gives up control. And then the doctors need more control and the moms become less empowered. And it just seems like a cycle. But what you did for her was you put her in the driver's seat 100% of the time.
Well,
because you weren't her midwife.
Well, but also, you know, I teach these principles of how to be that kind of midwife. And if you're practicing holistically, then you are in a partnership and nobody's better than anybody else. There's no hierarchy there.
It's true.
You're both adults. You both have life experience and skill. You have things to share. And one of the markers of the holistic midwife is she prefers to not give advice. It's that moment of when the mom says, what should I do? And you say, well, what do you think you should do? Or mom comes in and she says, oh my God, I'm so stressed. And you say, well, on a scale of 1 to 10, how stressed? 10 being the highest. She goes, well, probably 9.75.
Great.
So then you say, well, what would it take to get it down to maybe a 3 or a 2? And she says, oh, you know, a week on the beach in Hawaii, but there's no way I could do that. It's not happening. And then you say, well, is there anything that gives you that Hawaii beach feeling? And she says, well, sometimes I get it when I'm in the bath and nobody's bothering me. And you say, well, can you arrange that? Do you need some partner to watch the children? Can you make that happen? And she goes, yeah, I think I can. So what just happened was she articulated her own health status, found her own solution.
Yeah.
And during the pregnancy, growing her own autonomy that is going to make the birth spectacular. And midwifery in that model of practice is sustainable because you're not carrying everybody's expectations around with you all the time.
And you're not carrying the fears and the liabilities too, but it's going to take a huge cultural shift to get back to that, where the midwife is, I mean, I think about stories of, the early settlers and who blamed the midwife when babies died. I don't know. It seems like our culture does blame the provider for anything that goes wrong, when really they have nothing to do with it most of the time, unless
we have
direct meddling.
We do have a long way to go in terms of that kind of reform, but for midwives to articulate their standards, I mean, I speak about this internationally, and everywhere I do, it's met with agreement. And I've even experimented with groups of midwives from all over the world to see, for example, if they could knock out a protocol on post dates. And the first time I did this, I thought there's going to be yelling, and it's going to be, it's going to be a mess. And at least when we start, they did it in like 40 minutes. They all agreed. And it was a progressive, excellent protocol based on skill and intuition. It was perfect. So I know we can do it. It's just a matter of me being more at the age of wanting to be a consultant to this process.
Yes, I see that. Well, with your example of what should I do, so many people just want, with good intention, want to sweep in and help someone, want to save them from whatever ails them. And that's born, especially, let me back up a little bit. The birth work, being a birth worker, is born of a heart call. And you mentioned that earlier. Instead, it's not a vocation, it's a heart call. And born from that heart call is this willingness, this wanting to serve and bless the lives of others. But that sometimes translates into control and coercion.
Yeah, Sarah, you really hit it. And like holistic care is one type of care. That another type of care is more what you're describing. It's the humanistic model of care, and it's bridging. Humanism bridges the gap between technocracy, where it's all about, technology.
Technocracy. I love that word.
So we got technocracy and humanism and holism. These are Robbie Davis Floyd's brilliant distinctions.
Yeah.
And the catch with humanism is that it is a model based on compassion, but also on giving advice. So you end up with codependency, and you end up with burnout, and you end up with far less than satisfactory outcomes, not just physically, but psychologically for everybody.
So in the holistic model that you're saying, where it's based on that example that you gave us just recently, what then would a midwife's role be? Would it be just to, clean up, provide warm towels? What role does she play when she is given that much?
She plays the same role. I mean, she's still probably going to be listening to the baby's heart rate. I mean, midwives are going to have practice protocols that they personally believe in that model of care, where this is my bottom line, what I need to do to feel comfortable at your birth. And there should be full disclosure of that from the get-go about what this midwife actually needs to do. And for most of us, it's going to be like we're not hardly ever going to do an internal exam unless we sense that there's truly an arrest of progress, which if you're attentive enough, you can pick up the difference between an arrest and a plateau, which is normal.
Yep.
And so
I know I thank my midwife up and down to the universe and back for what she did at my fourth birth, because all she said was, I know you don't want to be checked, but I feel like something's up and maybe I could help if I knew what was up. And she did. She felt that lip. She had me turn position and baby was born. And I'm like, thank you for saving me from another hour of unhelpful labor.
That's what we're supposed to be doing. And occasionally we're full on. Like, you can have a birth with a shoulder dystocia, a neonatal resuscitation, and a partial separation of the placenta with a manual removal. I mean,
that sounds like fun.
Oh,
I've seen it. No, it's not.
It's not. But, I mean, birth works, and getting back to those points and of the beauty of birth. And I want to share a little about my school, if I can.
Yes.
I just want to tell people that I have a course. It's named after my textbook, Heart and Hands, A Midwife's Guide to Pregnancy and Birth. You can find all this on my website, elizabethdavis.com, really simple, about my classes, about my school and everything I've published. But mostly I want to share that the coursework that I have is linked to the National Midwifery Institute, but it's also freestanding. So you can take my coursework, and if you later decided to enroll in NMI, National Midwifery Institute, you get credit for it, and the money you paid me is taken right off your down payment. And now I'm teaching virtually.
Yeah.
And, at first I didn't really want to be doing that because I'm a hands-on skills person, and I still do it pretty much like a classroom. I'm still doing demonstrations with the pelvis or with a doll or with a little placenta or whatever else that I need to show. But the beauty of it is now I have people from all over the country. And, for a long time, it was just the Bay Area. Now there are people from everywhere, even around the world, are sitting in together with me. And I never do more than 11 people in a group. So,
wow, that's really cool.
So if you're curious about exploring the kind of midwifery I'm advocating, then get in touch with me.
And this is something that even an OB could do. It's not like they would have to leave their station, just implementing some of these these philosophies.
Yeah, I wish. I do have a number of students that are heading into nurse midwifery for their own reasons, and they take this class just to get a foundation in birth is not just normal, but transformational. Yeah.
It's almost like the way you had the opportunity to imprint on the two most beautiful things, birth and adoption. You imprinted right there from the get-go. You're providing the opportunity for midwifery students to imprint right from the get-go on this philosophy of autonomy, respect, love.
It's the way that you check yourself on your educational path is, number one, am I becoming the kind of midwife I would want at my birth?
Yeah, that's a good one.
And don't ever let any teacher take you away from your inner knowingness, because in medicine, it's the opposite. You don't talk about fear. You don't talk about like any inadequacy you have. But in midwifery, well, like one midwife said, every woman has fear, but what the midwife does is she treats that fear with respect.
Yeah.
And treating our fear with respect is foundational to staying connected to our strength. And that's the way we need to bring midwives forward that can actually meet the needs of women that we both described.
Yeah. Well, thank you so much, Elizabeth. Thank you so much. This has been such a fascinating conversation. If you want more information about Elizabeth Davis, like she said, you could go to elizabethdavis.com, or you could also reach out to me at media@birthcircle.com, and I'll put you in touch with all of her amazing resources, her books, and everything. Thank you. Please visit us at birthcircle.com, join our Facebook groups, or find us on Instagram and Pinterest. We hope you'll use our resources to support your birthing experience.